No private hospital given approval for COVID-19 treatment, Health Minister. The Federal Ministry of Health has not accredited any private hospital to treat COVID-19 patients. Health Minister Osagie Ehanire disclosed this on Friday during the briefing by Presidential Task Force (PTF) on COVID-19 in Abuja. The minister noted that although some private hospitals have shown interest to treat the virus, none have met the criteria to receive approval yet. No accredited private hospital has been given approval in Abuja. Lagos is looking at some accredited hospitals. There's no one large hospital in Lagos that has called me and said they want to become a coronavirus treatment center. The structure of the hospital is that they are ready to remove all present patients they have and do nothing but coronavirus treatment. That would be good because they don't stand any chance of cross infection. But at the moment, there is no hospital that has met the criteria. Treating of private patients is not allowed. It is risky. Coronavirus is one of the most easily transmitted disease you can think of. So, it is not allowed to treat coronavirus privately, he said. Ehanire added that there are major guidelines that need to be adhered to for a hospital to be able to successfully handle COVID-19. If you are a private person and you want to run a treatment center, you have to show that you have the staff. The doctor must be an infectious disease specialist. You need nurses and even cleaners that are trained because the handling of this hospital is different from ordinary hospitals. They must be trained in infection control professional protocol. This hospital must be properly ventilated. You have to have inspection by a team of accreditors that will give you go ahead. The minister said, since there is no hospital that has met the criteria, treating of COVID-19 patients privately is risky and not allowed. Ehanire concluded that the earlier diagnosis treatment of COVID-19 patients is very important to avoid fatalities. So my people, that's the news reaching us. Just in case you haven't subscribed to us, please do press the subscribe button and also the small bell there just to notify you whenever we upload any news. And also don't forget to give us a thumbs up to let us know that you appreciate what we're doing. So let's go back to the news. The health minister, Mr. Osagie Ehanire, has said on Friday during the briefing of the Presidential Task Force on COVID-19 in Abuja, saying that no private hospital in Nigeria is accredited to actually treat COVID-19. But the question is, where have they been all the while? Because obviously, if COVID-19 has entered Nigeria over a month ago, it doesn't take too much to get the private sphere to be accredited for all hands to be on deck to contain the virus. So already, he has said that an inspector from infectious disease, needs to accredit the hospitals for they to be able to give treatment to COVID-19 patients. Already, some private hospitals in Nigeria had already identified their interest in treating the COVID-19. So there is no need to wait at all for anything whatsoever. Let the minister get their hands together. Let them think. Let them check the hospital, do all what they need to do, and let them start. Even in fact, before talking about treatment, let's get testing centers. These hospitals that agreed to treat COVID-19, they could start by using them as test centers, So when they start as test centers, then they move ahead to become a treatment center. So everything that needs to be done for these hospitals to be able to treat COVID-19 patients should be done. We have seen videos of even the COVID-19 quarantine places. They are not really the state of the art. Like we said, we can see what happened to Mr. Abba Kyari today, on Friday. So our healthcare system is really lagging behind if you compare to even African countries or the world at large. So these are the sort of things, because the private sector always boosts the economy and boosts the government as well. You see, so we need to quickly get the private hospital to start doing this as well. One hospital in Lagos has said that we're going to remove all our patients that we have presently and turn the place to a COVID-19 treatment center. Quickly, we have to do that immediately. The health minister has to look into that quickly for Lagos. Yes, that is very, very important. The private hospitals has to come into play. The government hospital, already we know that we don't have equipment and facilities. A lot of things are not in place in the government sphere. So we need to quickly get the private hospital on deck. We need to get them with the health minister needs to look into, and in fact, it needs to be fast forwarded. You see, in Italy, they had to graduate all their final year medical students so they can have a lot of doctors to treat the COVID-19. You see, so everything that needs to be done has to be accelerated at this point in time. You know the way checks goes in Nigeria. You know how they say, all the protocols that goes in before you can be accredited in Nigeria. But at this point in time, with the hospitals, with life and death, these things has to be accelerated. In fact, it has to reach the presidency so they can accelerate things quickly, so that the private hospitals can start looking into either a test center or being a treatment center. So my people, that's the news reaching us. That's what the health minister has said, that no private hospital in Nigeria is accredited yet or is fit to treat COVID-19 patients. So the question is, when are they going to accredit them? When are they going to start treating? And why can't they start by using them as a test center and deploy some doctors and a lot of people into it? Because one of the things that Mr. Ehanire said is that they need to have the right nurses, the right amount of nurses and doctors as well. Why, if an hospital has indicated interest that they want to be a COVID-19 patient, all we needed to do as a government is to deploy doctors and nurses and to align with what they've got in the private hospital, then deploy nurses and doctors to the hospitals and make sure that they are able to work together to see that they become a treatment center. So the question that Nigerians are asking is that, what are they doing to accredit them? What are the measures to deploy doctors into even those hospitals that don't have a lot of doctors or nurses? Because however the small or big the hospital is, if they see that it's not enough people to handle the disease, then get nurses and doctors from the government sector into the private sector as well. So every hospital can be functional. So I think that is the news reaching us today, my people. So we want to hear your comment. We want you to comment on this. We want to see your comments in the comment section. And also, just to hear your voice, we want you to have your say whenever we have any news on board. And also, my people, if you haven't subscribed, please do press the subscription button. It's very important. And also the small notification bell there, just to alert you whenever we upload any news. And also, please do like, share, and subscribe. Thank you very much, my people. We do appreciate you coming out here to listen to us. God bless you until we come your way again. Bye.